Chapter 22: Substance-Related Addictive Disorders. Substance use disorders are a very common issue all throughout society, and they're defined as the pathological use of a substance that leads to a disorder of use. Symptom groups could include impaired control, social impairment, risky use, or physical effects such as intoxication, tolerance, or even withdrawal. There are a wide variety of substances that could lead to use disorder. Everything from alcohol, caffeine, cannabis, marijuana, hallucinogens, inhalants, opioids, sedative hypnotics, stimulants, or even tobacco. Also, things like gambling and shopping could also be classified as addictions. There are several concepts central to addictive use disorders. Everything from the addiction itself, defined as a chronic medical condition. Intoxication, this is the active process of using a substance to excess. Tolerance, this is where a substance takes a higher and higher dose to achieve that initial level of response. And finally, withdrawal. These are symptoms that occur when a person stops using or is unable to receive the substance. Some of our more common addictive substances is going to be alcohol. Not only is it legal in all 50 states, but it results in about 15 million people are addicted. And when you're addicted to alcohol, it has some very, very serious withdrawal effects. Other substances that are legal in varying forms would be marijuana, which up to 38 states currently as of 2024 allow medical marijuana. And also opioids, which very central to us here in healthcare. There has been a major pendulum swing where they've been really trying to restrict the amount of opioids out within society. Yeah, as of right now, about 2 million people are addicted to opioids as well, which is another drug with very, very serious addiction considerations, as well as the effects of the withdrawal. For psychiatric comorbidity, this is any combination of two or more substance use disorders and mental disorders. I know this is a topic we've talked about a lot with our mental health conditions. In a lot of cases, these patients are using illicit drugs. They are abusing drugs. And a lot of what they're doing is they are self-medicating themselves with illicit drug use. As with anything, there's a wide range of factors, everything from genetic factors, neurobiological factors, and environmental factors. It's that nature versus nurture. Also, things like socioeconomics and poverty raises the risk of an unfavorable living environment, lack of parental supervision, poor educational resources, and impaired support systems. This cycle of negative environmental events often begins with disadvantaged neighborhoods, increasing stress and anxiety along with a lack of or negative social ties, which further contribute to that depression and potentially substance abuse. Anthony, 20, was found badly beaten and semi-conscious in an alley. He had passed out and vomited and was brought by police to the ED with a blood alcohol level of 0.15%. When he awakened, he looked around the ED environment and panicked and struggled to get up. When the staff calmed him down, he struggled not to cry and said, "Why didn't you just leave me there? Why didn't you leave me to die?" Other addictive substances would be caffeine. This is the most widely used psychoactive substance in the world and can result in intoxication, overdose, or withdrawal. I know for me, I drink a lot of coffee through the week. A large pot of coffee is about my minimum baseline. Sometimes on the weekends, I'll wake up and forget to make coffee and suddenly start to get a headache and realize that, oh, I haven't had coffee yet today. Also, other things like cannabis. This is the third most commonly used psychoactive drug in the United States after alcohol, and it's becoming more and more common and more legal. At this point, it's medical marijuana is legal in 38 states. I don't think there's any going back. Eventually, it's just going to be fully legal. When you have recreational in states like Ohio and Missouri, I don't think there's any going back on where they're at. And also hallucinogens. These can cause profound disturbances in the patient's thought process. Another would be inhalants, or huffing as the kids used to call it. This is solvents for glues and adhesives, propellants, thinners, fuels. And note these specific examples of inhalant types. For propellants, you're looking at aerosol paint sprays, hairsprays, and shaving cream. For thinners, you're looking for paint products and correction fluids. And fuels, things like gasoline or propane. Another major area that's across the country, unfortunately, is opioid use disorders, such as heroin and prescription drugs. Back in the early 2000s, a drug called Oxycontin was prescribed and prescribed a lot. And even as they've pulled that back, there was a lot of cases of opioid addiction of something that their doctor had given them. And then once they were cut off or not getting enough to get the high that they were initially getting, they started going out on the street for heroin. And yeah, I guess it's more fentanyl now, which is even scarier in some ways. Anyway, that opioid intoxication results in cravings, resulting in larger amounts, longer periods of use, and increasing tolerance to its effects. It results in significant impairment roles, and it can really take over a person's life. It is extremely, extremely addictive. Also, keep in mind if you're ever on NCLEX and it comes up, how do opioids kill? Opioids kill by respiratory depression. We've got that antidote, that Narcan, that naloxone, which can actually block the patient's opioid receptors and take them right out of intoxication. I remember back as a paramedic, you would give patients Narcan, and I mean they'd sit straight up, and they're upset. They from where we're sitting, they're turning blue, you're dying. For their sitting up, they were exactly at the high they were looking for, and they're confused where they're at, and they're very angry. For opioid intoxication, that death's again usually due to respiratory arrest, and we want to promote the patient's breathing, bag valve masks, and Narcan. In the case of opioid overdose, the symptoms of overdose include unresponsiveness, slow respirations, coma, hypothermia, hypotension, and bradycardia. Three symptoms, coma, pinpoint pupils, and respiratory depression, are strongly suggestive of overdose. Treatment of an overdose begins with promoting breathing by aspirating secretions, inserting an airway, mechanical ventilation, Narcan, a specific opioid antagonist, and has FDA approval for opioid overdose and can be given intranasally, intramuscularly, subcutaneously, or IV. Other problematic substances include benzodiazepines, benzodiazepine-like drugs, barbiturates, other drugs. In the case of this, we're going to correct this with gastric lavage. That is withdrawal, the gradual reduction to prevent seizures. In the case of opioid withdrawal treatments, methadone. Is often used, and this is a synthetic narcotic opioid, and it's used to decrease the painful symptoms of opioid withdrawal. Other drugs can be used, such as clonidine, and this is often used to reduce the symptoms of opioid withdrawal by blocking neurotransmitters that trigger sympathetic nervous system activity. Also, buprenorphine could be used, and it's used to help people reduce or quit opioids. Buprenorphine is an opioid partial agonist, and like opioids, it produces effects such as euphoria or respiratory depression. But these effects are weaker than those of drugs such as heroin or methadone. Working detox, I worked dual diagnosis for a long time. And yeah, seeing patients in opioid withdrawal, it really looks like the flu from our perspective. They're sweating, their body aches, they just look miserable. On the other hand, stimulant use disorder. This is amphetamine type, cocaine, or other stimulant drugs. And it's second only to cannabis as the most widely used illicit substances in the United States. For the withdrawal treatment is group and individual therapy. Possible diazepam for agitation. 1 to 2 weeks cocaine withdrawal requires no inpatient care, no drugs to reduce the symptoms. Though we do want to treat the depression once that withdrawal is complete. Working again in dual diagnosis, those patients they know how the system works. And often they'd go next door, they'd have a drink or two, come in. I'm an alcoholic, but I'd also like treatment for my cocaine addiction. Really, they're not an alcoholic, but they knew that Medicare would not pay for cocaine withdrawal. So unfortunately, it's not as life-threatening. At the same time, it looks very miserable too. A lot of nurses, it can be very difficult to treat. In the case of cocaine withdrawal, they just want to eat, sleep, and cry, to put it frankly. Think about you haven't been eating, you haven't been sleeping, you've been awake on hard stimulants for a long, long time. And they're very emotionally labile. They're very sad. They're very depressed. Yeah, they just want to eat, sleep, and cry is the best way to describe it in a nutshell. Other disorders, tobacco. Quitting smoking can be very difficult. Yeah, I quit smoking a few times. I smoked in my younger years, and yeah, it can be tough to quit smoking. Get very aggravated. Withdrawal is distressing. For the treatments, behavioral therapy, hypnosis, nicotine replacement therapies, and also gambling disorders. Think about support groups, Gamblers Anonymous, SSRIs in the case of severe gambling addiction. The doctor may consider medication therapy. For our first audience response question, a patient is admitted to the ED experiencing respiratory distress due to opioid overdose. As soon as his respiration is stabilized, which drug should be administered? A. Naloxone, B. Bupropion, C. Methadone, or D. Clonidine? In this case, that answer is going to be A. Naloxone, Narcan. That is that antidote drug for severe opioid intoxication. The others would be used for long-term withdrawal. In the case of alcohol, we're gonna be looking at usually sedatives, Ativan, Valium, things like that to control the seizures, lower that seizure threshold. It's going to be a sedative with an initial euphoria. It's going to be the severity based on the number of DSM-5 symptoms. Mild is going to be 2 to 3 symptoms, moderate is 4 to 5, and severe is 5 or more symptoms. And each facility is going to have a charting protocol where you're going to grade this patient's withdrawal symptoms. For us, it was a CWAB, though there is many different forms used across the country. For alcohol use disorder, it's almost twice as prevalent among adult men than adult women. American Indians, Native Alaskans, 12.1%, have the highest rates, and that's disproportionately affected by alcohol problems. As someone who lived in Alaska for a few years, alcohol problems are very common throughout the state, throughout all ethnicities. It has some very extreme weather, especially in the wintertime, when the sun's not coming up or only coming up for an hour or two. It can be very easy to stay home and drink. You really have to enjoy the outdoors, get out and do things instead of just sitting in your room. Alaskan winters could affect some people very hard. And unfortunately, alcoholism is just a problem across that state. Other comorbidities include bipolar disorders, schizophrenia, antisocial personality disorders, and major depressive disorder. There's going to be, again, genetics, neurobiological causes, social and cultural causes, and 2 different types, binge drinking and heavy drinking. In the case of alcohol intoxication, the legal definition of intoxication in most states is a blood concentration of 80 or 100 ethanol per deciliter of blood, often expressed as at 0.8 or 0.1. Also make sure that alcohol withdrawal can also be very delayed. Keep that in mind for your patients as well. It could take several days for these alcohol withdrawal symptoms to manifest. Also, cognitive disturbances such as Wernicke-Korsakoff syndrome, which is a chronic lack of vitamin B at its base of it, causing neurological symptoms. You got to remember when you drink a lot of alcohol, you're urinating a lot because your body's flushing out that alcohol. But it's also flushing out your water-soluble vitamins, such as vitamins B and vitamin C. You get a lot of vitamin C in your diet. You don't get near as much vitamin B. And that vitamin B plays a real key role in neurologic function. That's why when alcoholics come into the ER, they get what's called that banana bag, that yellow IV with all the supplemental vitamins in there, because they've probably been very vitamin malnourished. Also, fetal alcohol syndrome, the case of alcohol affecting the fetus in utero. Other systemic effects of alcohol use disorder are peripheral neuropathies, alcohol myopathy and cardiomyopathy, esophagitis, gastritis, and pancreatitis, alcoholic hepatitis, cirrhosis of the liver, leukopenia, thrombocytopenia, and unfortunately cancers, especially of the head and neck. And application of the nursing process. Anthony is admitted to your psych unit from the ED. A history reveals a dual diagnosis of both major depressive disorder and substance use disorder. His history reveals he grew up in group homes where early evidence of childhood depression was labeled as moodiness by foster parents, and he was categorized as hard to place. He performed poorly in school because he couldn't concentrate and turned early to drugs as an escape from the hopelessness. Other screening tools that could be used here: the SBIRT, the Screening Brief Intervention and Referral to Treatment; the audit tool, the Alcohol Use Disorders Identification Test; the CAGE, this is 4 questions to identify alcohol abuse; the CAGE aid, the same questions as CAGE but adds drug use and alcohol; and the TACE, the Tolerance, Annoyance, Cut Down, and Eye Opener. Looking at the nursing process, we want to make sure we're doing family assessments, applying nursing diagnoses, and planning, identifying the problems, setting a goal, and determining the best interventions to accomplish that goal. Also identify patterns such as codependence. This is a cluster of behaviors originally identified through research involving the families of alcoholic patients. People who are codependent often exhibit over-responsible behavior, doing for others what others could just as well do for themselves. People who are codependent often define their self-worth in terms of caring for others to the exclusion of their own needs. Keep in mind that people are often very codependent and that drug use can go in husband and wife, runs in families. Shortly before kicking Anthony out, his girlfriend had stayed home from a planned night out with her friends to pour all the alcohol in their apartment down the drain. What type of behavior is evident? A, enabling; B, tolerance; C, codependence; or D, use of defense mechanisms? In this case, the answer is C, codependence. Again, is that cluster of behaviors originally identified involving families of alcoholic patients. She is trying to protect Anthony by destroying the alcohol, pouring it down the drain. As far as implementation, we're going to be promoting safety and sleep. These are first-line interventions, as often many withdrawal and substance use are going to be very lacking in sleep and also having trouble sleeping. Also want to reintroduce good nutrition and hydration, provide support for self-care, and exploring harmful thoughts and spiritual distress. Often severe drug use, it's going to be a long road to recovery. For evaluation, we're going to be assessing the effectiveness of the treatment plan, using objective data to check whether nursing actions address the patient's symptoms, and measuring the changes in the patient's behaviors for progress towards meeting those stated goals. For pharmacotherapy, be things like disulfiram for helping with opioid alcohol abstinence, naltrexone, benzodiazepines. Remember that motivational interviewing. This is an approach based on the trans-theoretical or stages of change theory. It's gained popularity in its use as a brief, long-term, and supplementary intervention, particularly in the treatment of substance use disorders. It uses a person-centered approach to strengthen their motivation for change. Other considerations could be the trans-theoretical stages of change theory, such as pre-contemplation, contemplation, preparation, action, and maintenance. In the care continuum for substance use disorders, there is detoxification, that detox, rehabilitation, halfway houses, other housing, partial hospitalization programs, intensive outpatient programs, outpatient treatment, Alcoholics Anonymous, and relapse prevention. Anthony is getting ready to be discharged. Because he's currently homeless, his caseworker finds him a place in a men's shelter while he continues to search for a halfway house for continued recovery and support. What other things should they plan to take into account for him? Everything from like acute safety needs, his housing situation that they've addressed, the severity and range of his symptoms, his motivation and readiness to change, his skills and strengths, the ability of his support system, and his individual needs as well. For the substance abuse treatment plan to be successful, you're going to be taking a wide range of factors into consideration because the major danger is that he will relapse. We want to give him every opportunity he has to succeed. Anthony is being discharged with a prescription for disulfiram, Antabuse, to help maintain a medical aversion to alcohol. In this case, when he takes that drug, if he drinks on top of it, he will get sick, and it's a way to keep them off of alcohol. In this case, what patient teaching should the nurse provide? We want to inform the patient that ingesting alcohol while taking this medication produces a toxic reaction that causes intense nausea and vomiting, headaches, sweating, flushed skin, respiratory difficulties, and confusion. Avoid all alcohol and substances like cough syrup and mouthwash that contain alcohol. Disulfiram must be taken consistently to maintain the aversion of alcohol. Anyway, that's the last slide we've got for this chapter. Yeah, substance abuse it affects every socioeconomic factor across the country. And it can be very, very sad, and that people can become extremely dependent on some of these substances. There are functioning alcoholics out there who've been drinking a fifth a day going back to when Reagan was in office. And often their withdrawal can be life-threatening. And it can take a very close assessment and a lot of work and management on your part and the nurse's part to not only get them through that initial withdrawal, but also the long-term recovery road they have ahead of them as well. But anyway, that's all we've got for this chapter. I'll see you in the next slides.